All right, what's going on, everybody? It's been a while since I last done another video. Wanted to give you an update in terms of what's been going on. Had a call yesterday that I lost. Things I could have improved on was took more frame, hold the conversation to my frame. She was a rambler. She said the things I wanted to hear. She was lazy. She wanted to make the change to become a better person to connect to a culture. I'm selling like a language offer. So essentially, I got all the information that I needed. The only thing that I couldn't get into a frame is the intention and the commitment to land. Even though when prospects say yes, it needs to actually land. So when you pitch, I did pitch, everything all made sense to her, but when I price dropped, I was objection handling the logistics versus the commitment to becoming that person that she wanted to become. So things that made it harder was she was from a different country. The conversion rate didn't actually make sense for her. Logistically, she didn't have that money. But I felt like on my end, the things that I could have changed was just having a stronger discovery, asking more why, where does that put you? Why are you selling yourself short? These are the things that I really wanted to improve on. But that aside, we keep working. Things that I've learned is going back to the vibrational chart, human vibrational chart, where the lowest is guilt and shame, and the highest is ascension or enlightenment. It's time to understand when people, or not understand, trying to still, learn this is why people still stuck in guilt and shame. This is also as a closer, as a sales rep, why I am attached, which right now I'm becoming less attached to the outcome of the commission and more attached to the outcome of someone's goals and seeing how I can actually attach them to understand that their way of thinking is selling themselves short. And if they want to actually go get it, they'll do whatever it takes to go get it. And the fact that they're not getting it is more them buying into their limiting beliefs. And I can think like that more, even if I go 3, 4 rounds of objection handling, I still would have felt detached from the fact that they're fighting for their beliefs and they're naming the beliefs. That even if I don't get the commission, at least they can see that I'm actually fighting for what they actually want, being on their side. And I feel like that's one thing need to start to invest to grow that way of thinking, because I feel like the last couple of months I've been wanting that commission so hard that it doesn't make me congruent or aligned with actually helping the prospect. On the other side of things, me being a physio, I am pretty much killing it, at least helping someone once a week, one new person once a week, and also helping a recurring person once a week. This is coming very common for me now, and all thanks to the ability to ultimately understand the human body a lot more, understand surface anatomy, know exactly what I'm touching, and also knowing what I'm doing, which is essentially fascial counter strain. And for those that don't know what that is the ability to assess the whole entire human body and to be able to find tender points, which are points which is blocked by inflammation, and it's the ability to decompress or compress and to be able to drain the inflammation from the site. So I did that this week and was able to relieve a fair bit of like neck tension, as in rule out 70 to 80% of that dysfunction and symptomatically get a change. And where am I getting this 70 to 80% from? Is when people say, holy cow, it feels different. When someone says it feels different, it's definitely more than 50%. And to get that kind of change, it's not 100%, but it has to be obvious. And 70 to 80, I always use that number as one is change, and two is very obvious to the client. I did that again from a lumbar point of view. Again, good old fashioned counter strain, getting really good at identifying if it's a rib component or if it's coming from a different system. Every person's low back pain is completely different. So it's kind of a little bit like art, where you have to treat every person's body like a blank canvas and you just have to work around that. So I'm very happy that I could get that. And if we take money out of the equation, there's no bigger satisfaction than actually using your hands and understanding human anatomy in a way where you can actually alter and change for the better someone's pain. And one thing I'm starting to think about is not a lot of people will invest the time, the energy, and the resources to understand how the human body works. I mean, that's essentially us. We all have eyes, we have a nose, we have lips, we have muscles, we've got skin. There's skincare for girls to look after their face and guys as well. We've got hair, we alter the way we look with haircuts, but we never, and we even go to the gym and even eat healthy. But we have to rely on a medical profession like a doctor, even a physio like myself, to offshore that information to get fixed. Because at the end of the day, not everyone wants to know this. Everyone has other hobbies, interests, and other things to pursue. But now I'm starting to think of it more like it's essentially like you got to know how to cook. Yes, you need to know what to put in your mouth for healthy food. You need to know how to do cardio and lift weights, and mindfulness like meditation. But we're getting to the point where we actually need to know a fair bit more about how anatomy and physiology works. And if you don't know that, you're at the mercy of us, physios and medical professions. And raise of hands, how many doctors or physios have you been to? And they've kind of been duds. And for the most part, that's one thing I'd like to kind of admit. Like I wasn't really that good at my physio hands-on skills until I actually learned fascial counter strain. And until then, I will do my very best to help a client. And if you don't have a good understanding of surface anatomy or how where the anatomical structures are, you're very limited in terms of what you can provide as a service. So that's one thing I've started to notice. It's the 18th of December now. This has been a breakthrough year for me in terms of how much success stories I've been getting. Last year was like the tip of the iceberg. There was some good stuff. This year, even more powerful stuff. I mean, the most powerful one, I'm not too sure if I mentioned it before, it's just getting rid of someone's double vision. Like, who the hell does that? Like outside of surgery and drugs, through just inflammation and assessing the anatomy. So that's one thing I'm super happy about. On the other end, my business not doing so good. Zero new clients, still negative 600 in rent per fortnight, I believe. And I just need to start networking with more doctors around the city, build a name for myself, get the referrals coming in, and at least break even. That's what I need to do. So two reoccurring or one new client a day, solid. Intentions for myself. Set higher standards. I need to be setting higher standards because I've noticed I've slipped a bit. Slipping in terms of my biggest demon that I have to focus on is focus. To be able to jump to the next level and just remain focused is one thing that I've noticed has been carrying along with what I've been limiting myself and capping myself at, because just looking back into my 20s, I've been doing so many different things and learning so many different things, and that's just a lack of focus. For me to stick with physio, the thing that I least like in my 20s, like I wanted to do surfing, drawing, painting, cooking, even working out, playing instruments. That all never worked out. But the fact that I stuck with physio, the one that I least like, because it gets me paid, I'm sticking through with this, which is weird to see and weird to say. But just setting higher standards moving forward, which means saying no to a lot more things, just focusing on paying off my mortgage. This year, I've done 30K. 30K in actual repayments. And I'd say of that, I'd say 30K, 12K of that would have been interest. which kind of doesn't really make any sense because I would have paid more. I don't know how that works. But essentially, all that extra, all my savings are going into the offset account. I wish I could be paying more. At this rate, it will take me 10 years. So at 43, we'll be paying it off. And that's the slower way. If I doubled it, we'll be done by 38. If I'm 33, 34 so far. And one thing from all that social media that I've been consuming, all the brain rot, there's one good thing that I took out, which was today. Everything else, I don't even remember what I've been doing scrolling. But the only stress is not because of the work, which is hard, or the amount you have to do. Stress and being burnt out come from avoiding what needs to be done. That's from Jeff Bezos. And that's so true. If I ask that to you, even to myself, what do I need to do? What kind of work am I avoiding? It used to be just, talking to more girls and getting into a relationship and not worried about that anymore. It's more about just getting skilled, finding clients, calling doctors, getting more leads, getting good at sales, and documenting all this. Once I document this, not that I'm less stress, I'll just be thinking less about the next time I have to be posting a video, which hopefully I'll do another one tomorrow. I have to say minimum 4, average is 8 per month, so twice a week. That being said, sales, not good. Physio, very happy. Business, not happy. Let's keep going.